Hello guys, myself Dr. Anjaligupta and today I am talking about the variation of influence of motor learning. What is motor learning? Motor learning is upon depend upon the variation of patient manipulation theory during the exercise, instrument, pre-learning consideration. Some of the feedback is okay or necessary of the exercises or some of the necessary development strategies for the successfully exercise instruct the trainer and briefly after that seeing what is the exercises depend upon the coursing and resource for the additional information too is added. We depend upon the all about our your therapist or your physician too. Pre-exercising consideration is the number of many of the influencer motor learning during the de-standarding and the purpose of the exercise task well and some of the task effective execution and skillful also. Attention of this task is affected learning at the ability to focus on the patient and there is the evidence non-prominent and demonstrate after that doing this thing. Okay, so let us see the patient will be depend how much he will be and he will be learn or doing the functional task corresponding to the describe. Practicing depend upon the patient how much he will be learn and they practice some of the motor learning is the fine motor or any other things exercises and all. Part of the Venus is of whole practicing and depend upon the whole and random blocked and whatever he will and she will be how much understanding and learning in this way. So let us see type of the practical for motor learning part of the various for part of the practicing and whole what is the how much enter and task performed for the beginning and the practicing the spectrum. Okay, and the scene the practice and this is the please screenshot. These things are more important because it is in the your some of the paper will ask then you will put the answer here. Okay, physical versus the mental practices some how much they will be active for learning and then the feedback is the most important how much percentage patient will be seen or not understand or not. Okay, so these things are important and intrinsic feedback and some of the augmented feedback. Augmented is the depend upon the some of the supportive and intrinsic feedback and all through of the during the progressive and conclusion task dependent upon the physiotherapist and trainer too. Okay, so these are the again feedback schedule. So current over postponed and the concurrent occurring during the performance of the task also known as a real time. Then patient has doing task it's a real time and then it's a virtual and immediate relay and summary postponed feedback immediate rate delayed and summary variation of the content and feedback too. Feedback schedule and timing of frequency depend upon the therapist. See the ultrasound and see the result. What is the rehabilitation of ultrasound imaging provided and manual feedback. Okay, so after that see the application of the motor and learning principle for the exercise and instrument of the sum. After adherence of exercise and the factor influence. What is the factor? Some of the factor like the parental related factor and the related health condition impairment like some of the genetic condition and some of the rehab related to some other factor are also important. Some of the symptom and cause are important. Okay, progress relatively and duration of the exercise program adequate and instrumental, these are the most important. And exercise instrumental attention counseling is most important part of the physiotherapist and patient to strategy of the forest adherence. So let us see what is the adherence and strategy. A therapist should expect the patient will be not notify adherence to any treatment program and particularly it regulate occurrence and disease or injury. So the most important hope is implement study for adherence. Some of the suggested or resource literature are noted. Okay. So see, okay. Thanks for watching. Please screenshot this strategy and forest adherence and exercise program. We will see study. Okay, thanks for watching.